There are so many symptoms of IBS that it gets a bit crazy. So listen really closely here. There might be pain, but there might not be pain. And when there is pain, it can be anywhere in the abdominal area, anywhere, right, left, up, down, top, bottom, you name it. And it can be occasional or it can be constant. It can be once a day or it can be once a month or even less. And the pain can be mild or it can be dull and achy, or it can be really severe, or it can be sharp and stabbing, and it can even be so bad that it puts you in the hospital. You can have diarrhea, or you cannot have diarrhea. Most people think that IBS is always about diarrhea. It's not. It can be either way. And it might not be diarrhea even if you have a problem. It could be loose stools that you don't think of as diarrhea. Or you can have constipation or not have constipation. Or you can have incomplete bowel movements that maybe you don't usually call constipation, but you never seem to feel completely evacuated. Or you might have rabbit pellets, or you might have stools like mud, or some people describe them like peanut butter or something. Or you could have alternating diarrhea and constipation. Or you could have neither diarrhea nor constipation, but have normal bowel movements and just have abdominal pain. Or you could have no abdominal pain and just diarrhea. Or you could have no abdominal pain and just constipation. You could have lots of super stinky gas or no gas at all. And you could have tremendous bloating, for example. A lot of people describe that with their IBS. Or you could have no bloating. And you could have mucus in your stool, or you can have no mucus in your stool. And some people even just pass mucus sometimes and nothing else, and they'll describe it that way. And sometimes with IBS, you even get a little bit of blood in your stool. And those are just the most common symptoms. There are many, many more. So for example, you might have weight loss, or you might have weight gain. Or your weight might be normal. You might be hungry all the time, or you might feel full all the time and never be hungry. Or your appetite might be perfectly normal. You might have nausea, or heartburn, or reflux, or hemorrhoids, or all kinds of other things that I can't even remember because there's so many problems that IBS can cause, even non-digestive issues. Now, once you know that you have IBS, there is good news because now you know what to do next. You need to work with an IBS specialist, which is the specialty I created in 2005 because there wasn't one. That's how you solve IBS. It's not impossible, it's just that you haven't worked with the right kind of specialist yet. And although we're rare, it's not as hard to find one as you might think because we routinely work with patients all over the US and the world via telehealth, and we've been doing that since 2005.